All right, today we're diving into a really critical medical emergency, something that happens right on the front lines of a hospital surgical ward. It's a condition every nurse is trained to spot, and we're about to find out exactly why it's so important.
So think about it. After a successful surgery, what's the one silent threat that could creep in and cost a patient their limb in just a few hours? Well, the answer is a condition that can start quietly, but then it just explodes with terrifying speed. It's a total race against the clock. And you know who the first line of defense is? It's a nurse and their careful observations.
So, let's set the scene. Imagine you're on a vascular surgical ward. You've got patients fresh out of surgery, and their blood flow might not be what it should be. For the nursing staff, those checkups aren't just routine. Not at all. They're more like a vigilant hunt for a red flag. You know, that one sign that tells them something is going terribly wrong, especially when they're checking on a patient's limbs.
So, what are they actually looking for? Well, with the patient's permission, of course, a nurse will go through this really crucial checklist. They're checking the color of the limb. Is it warm to the touch? Can the patient feel anything? Or is it getting numb? Is there any swelling? Can they move it? They'll even check the capillary refill time, and probably most important of all, they're feeling for a pulse.
Now, what if they can feel a pulse by hand? That doesn't mean the search is over. Nope. Out comes a handheld Doppler device. It's this little ultrasound machine that can literally hunt for the sound of blood flow. And if there's any sign of things getting worse, like a weaker pulse or the limb feeling colder, that gets escalated immediately. This is a big deal.
And here it is. This is the villain of our story today, compartment syndrome. It's a really serious condition where the pressure inside a muscle compartment builds up to dangerous levels. And this pressure, it can completely cut off blood flow, basically starving the muscles and nerves of oxygen. And if that goes on too long, you're looking at tissue death.
So how does this even happen? Well, think about your muscles. They aren't just floating around in there. Your muscles, nerves, and blood vessels are all bundled up together in these little compartments, and they're wrapped in this tough, fibrous sheet called fascia. You can think of it like a tight, protective sleeve. But here's the crucial part. That fascia, it doesn't expand. It can't stretch at all.
So you can see where this is going, right? When swelling happens, maybe from a bad fracture, a car crash, or even just after surgery, all that extra fluid has absolutely nowhere to go. So the pressure inside that non-stretchy compartment just builds and builds and builds until it literally squeezes the blood vessels shut. No blood flow means no oxygen. And without oxygen, the tissue starts to die. It's just a devastating domino effect.
So, how on earth do you spot this? Well, the single biggest red flag, the most telling sign of all, is pain that is just completely out of proportion to the actual injury. I mean, a patient could be on super strong painkillers, even something like fentanyl, but they'll tell you the pain is still absolutely excruciating. That right there is a massive, massive warning sign.
To remember all the key signs, nurses and doctors use a pretty clever mnemonic, the 6 Ps. Now, the first few are your early warnings. You've got pain, that crazy disproportionate pain we just talked about. Then pallor, which is when the limb gets really pale and white. Then there's pressure, a feeling of intense tightness, and paresthesia, which is that classic pins and needles sensation. But if you start seeing the last 2 signs, you're in a much, much more dangerous stage. Those are paralysis, the inability to move the limb, and pulselessness, a faint or totally absent pulse. By the time you get to those last 2, some really significant damage may have already been done.
The second that compartment syndrome is even suspected, everything just changes. The whole situation becomes a full-blown medical emergency. The on-call surgical specialist, the registrar gets paged immediately, and the patient is made nil by mouth, which means no food, no water, nothing, because they're getting prepped for urgent surgery. Every single minute counts.
And this slide just lays it out perfectly. The stakes could not possibly be higher. If you leave it untreated, you're looking at permanent nerve damage, muscle death, and maybe even amputation. But with urgent surgery, the pressure gets relieved, blood flow is restored, and the limb and all its tissue are saved. I mean, it is about as stark a choice as you can get.
So what's the solution? It's a life-saving procedure called a fasciotomy. A surgeon makes these long, deep cuts through the skin and right through the fascia itself to let all that dangerous pressure out. And what's really interesting is that the wounds are often left wide open for a day or 2, just covered with a sterile dressing. This lets all the swelling go down before they go back in and close everything up.
Okay, so the surgery is a success, the pressure's gone, the limb is saved. Great news, right? Well, yeah, but the danger isn't necessarily over yet. There's actually a secondary threat that the medical team now has to be on the lookout for.
And that threat is called rhabdomyolysis. You see, when muscle tissue gets that severely damaged, it starts to break down and release all these harmful proteins and toxins straight into the bloodstream. These toxins can completely overwhelm the kidneys and cause acute kidney failure, which, as you can imagine, is another life-threatening condition all on its own.
So how do they even know if this is happening? It's actually a pretty simple blood test. They look for high levels of an enzyme called creatine kinase, or CK. If those CK levels are sky high, it's a clear sign that muscle is breaking down. That confirms rhabdomyolysis, and it triggers an immediate treatment protocol.
And a team just springs right into action. The patient gets put on IV fluids right away to try and flush all those toxins out and protect the kidneys. Their urine pH is checked constantly, their fluid intake and output are monitored like a hawk, and the hospital's rapid response team might get called in. They might even move the patient to a higher level of care, like a high-dependency unit, which is basically one step down from the ICU.
So, what's the big takeaway here? I think it's that from that very first limb check all the way to monitoring for these secondary complications, it all comes down to being vigilant. In medicine, careful methodical observation, it isn't just another task on a checklist. It's truly a superpower that stands between a patient and a totally life-altering outcome.
And that kind of leaves us with one last thought, doesn't it? We've just gone deep on one hidden danger that can lurk after an injury or a surgery. But it really makes you wonder, what other silent threats are out there that medical teams have to stand guard against day in and day out just to keep their patients safe?